Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Molly Mraz, Public Information Officer for the Harford County Health Department, and your host for today's Public Health Matters. It's the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. Nearly 6 million households live with moderate to severe housing hazards, including lead paint, water intrusion, injury and safety risks, pests, and electrical deficiencies. These environmental factors can put families at risk for illness and injuries. This leads us to our topic today, which is lead and asthma. And joining me for today's show are Judy Churn, a community health nurse, a supervisor from the Harford County Health Department, and Dr. Clifford Mitchell, the Environmental Health Bureau Director at Maryland Department of Health. Welcome to our show, and thank you for being here today.
Glad to be with you.
Those risks make me not want to own a home that we just talked about. So tell me a little bit about what your jobs are at MDH and the health department. Judy, we'll start with you.
Well, at the health department, I'm actually a lead case management nurse. Each county has a contact person for those children who have been deemed lead poisoned. And so we actually go out on the home visits with Maryland Department of the Environment, try to figure out where the source of lead might be, give them some information about how to reduce the risk with regards to whether the hazard is in their home or in the outside, and then nutrition to help them reduce the risk.
And Dr. Mitchell?
So the Environmental Health Bureau at the department is responsible for a number of programs, including food protection. We work on violence and injury prevention and surveillance. We also have a program that deals with hazards in the home and in the community. So if your child goes to summer camp, to youth camp, we license youth camps. We also have a program that deals with a number of home hazards. Those include radon with the Maryland Department of the Environment, lead, asthma, and a number of other safety programs. And one of the exciting new programs that I'm sure we'll talk about a little bit more as time goes on in the hour is our new program through Medicaid and with Medicaid to make home visits available for children with either asthma or lead exposure.
Okay. So people may not be aware that there's a relationship between lead and asthma. They probably think they're two separate things. Can you talk about the relationship between the two?
Sure. The reason we talk about those together is not because they are the same thing or even related from a medical point of view, but they're both very strongly related to environmental conditions in the home. So one of the things we look at is, how do you prevent lead poisoning? How do you, with children who have asthma, prevent them from having asthma attacks, from wheezing? How do you make them go longer between symptoms? And those questions are both answered by improving environmental factors in the home.
By doing?
Well, there are a number of things you can do. So in the case of asthma, for example, we know different children have different triggers for their asthma. Some of those are allergic. They may be related to dust mites, to cockroaches, to mold and other allergies, to seasonal allergies, to pollen and things like that. So we can't keep the grass from growing, and we can't change seasonal allergies except by different kinds of immunotherapy. But one of the things we can do is look at conditions in the home. We know there are some very strong factors that influence asthma. Smoke in the home, allergens in the home like cockroach, mice, pets, dander, etc. So we work in our home visiting program and in our educational programs to help parents identify and work with parents to identify those triggers as their healthcare providers do, and reduce them so that the child has fewer triggers in their environment. With lead, same kind of thing, although it's different, because with lead we look for signs of conditions that can lead to lead poisoning, and I'm sure Judy can talk about some of those because she deals with those all the time.
Do you want to go ahead and just dive
Sure.
right in?
With housing, if your home is older than 1978, you may have lead paint in your home. Definitely if your home is older than 1950. And so we have probably almost 50,000 homes in the county that are older than 1978. So there is a risk with lead paint in those houses. And what is happening, people are buying those homes and beginning to renovate all by themselves, and the next thing you know, their child is exposed to lead. Or they live in an old house, a rental. They really are not sure whether there's lead there. So there is that risk. If you have peeling paint, old windows, that is certainly a risk too. Any kind of doors that rub together, it creates lead dust.
So if you're, I'm sorry, you go ahead.
No, what I was going to say is, so one of the things that we try to do both with asthma and with lead is help parents identify risks and work with the local health department as well as state agencies, both the Department of Health and the Department of the Environment, to try to address those risks. In the case of lead, the Department of the Environment is the lead agency along with the Department of Health to help ensure that rental housing in particular, because you don't have any control over the rental housing, it's the landlord who does.
Right.
Those homes are required to be registered with the Department of the Environment. There are programs to ensure that the owners have checked for lead and abated it or removed it if it's present.
So that was my question about for lead. Like, so you say you buy this home, you see it has chipped paint. It's safe to say it's lead paint. How do you safely remove that? What do you do to eradicate the lead?
So one of the things that we encourage people to do, especially if they've got children, is, and they're concerned about lead paint, there are kits that you can do to look for lead paint yourselves. There are also inspectors in the private sector who will go out and inspect your home for lead. Private home contractors now are required to have training in what's called renovation, repair, and painting. And it's a federal requirement that they be trained in how to safely remove lead paint. And I do want to stress, as I think Judy has experienced many times, that one of the things that you run into is people may not know that there's lead. They do some renovations themselves, or they bring old furniture in, or old antiques that they've gotten. And that's where we've seen in privately owned homes that children have been exposed to lead, and their parents obviously, they don't want to expose their children to lead, which is why it's important to check when you've got any concern at all about old paint.
I would be interested to see if there is any correlation between like the new DIY generation, everybody doing things themselves, and any kind of increase in lead, because again, you're doing it yourself and not necessarily knowledgeable on how to get rid of lead, or like you said, bringing in antique furniture and rehabbing it, and then maybe not getting rid of that.
It's one of the things that we have seen a lot, and this is one of the things that's, I think, important for people to understand. Maryland's lead testing requirements, that you test your child, that for the provider, the healthcare provider, test the child at 12 and 24 months of age, is because you can't tell whether a child necessarily has been exposed to lead unless you test. There's no other way to tell, really. And we've seen a number of cases where families that are affluent, families that have a lot of means, people think of lead historically as a problem of the inner city, and it is true. A lot of exposure happens in the inner city where housing is older. But we've seen some very new homes, well-to-do, affluent homes, where people have gone in and taken antique furniture or antique mantelpieces and things like that, and the child's been exposed to lead. So one of the reasons we've done this is because there is no jurisdiction anywhere in Maryland where we are not finding children with lead exposure.
This is one of these shows where I'm going to go home and be terrified and then look at everything in my house because I'm scared to death of lead exposure. How would you recognize somebody who had lead poisoning? What symptoms would you look for? Judy, do you want to take that one?
Basically, you would not. with lead poisoning, you really don't recognize anything with your child unless you do test. Now, there may be some issues with gastrointestinal, there may be some behavior issues, kidney issues, but many of the times you don't have any idea. We had a child recently with a very high lead level, and it was not caught until the child was tested.
And then how, besides lead paint, what other sources of lead could there be in the home?
Good question. So in Maryland, still the number one risk is paint. But we've seen a number of, and an increasing percentage of lead exposure cases in children where the children have been exposed to a variety of different things. So for example, you probably have heard that there have been some toys identified, produced internationally, but you can't necessarily tell that they've got lead in them.
Right.
We've also had cases of a number of foods and or spices where children have been exposed. Again, we've had spices like turmeric, where lead chromate, which is a nice yellow pigment, has been added in some cases overseas. These are spices that have been sourced overseas, not here in domestic production. But they've actually had lead intentionally added to them to increase the yellow color. We've had cases where different foods have been identified. And we've also had cases where children who have emigrated to Maryland from other locations have been exposed in those other locations. So again, we are seeing an increasing percentage of children with other kinds of exposures. And our job, along with the Department of the Environment and local health departments, is to go in, try to identify those sources and remove them. And we want to do that in a sensitive manner, because in some cases this has to do with cultural practices. There are some cosmetics, for example, that people have used that have been found to have lead in them. So it's a variety of different sources.
Right. And then are there any, I mean, I just remember reading an article about like dollar store items, toys, specifically children's toys, plastic toys, anything they can put in their mouths, not to, you know, just be wary of purchasing those items because they could have an increased lead level. And it's not always on the package, right? I mean, you don't know that,
it's usually
that
not
lead
on
is in the package,
right?
Right.
Exactly. In many cases, because lead is a cheap, malleable metal, that is to say it's easy to form into different shapes, and it's got a relatively low melting point, it's used very frequently in various kinds of products. And so you can't tell unless you test. And we in the United States there are a number of laws both at the federal level and at the state level to regulate lead in consumer products. But we don't always know what's happened when the toys are originally manufactured.
Right. And then what's the treatment if somebody has lead poisoning? Are there any treatment options?
Judy, you want to talk about some of the treatment options?
Well, for low-level lead poisoning, and actually all of them, is to remove the source if you can find it.
Okay.
That is the most helpful thing, whether it be even to move out while renovations are done or change locations, change your address. The other couple things that you can do, good nutrition. Make sure that you have a diet that is high in iron, vitamin C, calcium, to make sure the child is not anemic.
Because why?
Well, good question. So lead as a metal looks to the body like a couple of different metals that are also very important to the body's normal functioning. One of the things it looks like is iron. So, and you know that iron goes into the formation of red blood cells, and so the body thinks when it gets an exposure to lead that the lead is supposed to be used in making blood cells, but it doesn't work the same way. And so as a result, the blood cells don't get made normally, and you end up with low red blood cell count. Second thing that it looks like is calcium. And calcium is important in the formation of bones. And in many cases, what happens is the lead goes into the bone and instead of the calcium. So both a diet that is high in calcium and in iron will help replace that, and it helps the body accommodate and, instead of using the lead, use the calcium and the iron.
For really high levels, though, there's a policy that the children really do need to go to a hospital or another care facility, because there are medications that can take the lead out of the body.
Right, those are chelating agents, and what happens is those are chemicals that actually bind with the lead, either in the bone or in the blood, and then help to excrete it through the kidney. But those are usually reserved for cases where the child has, as Judy said, has a very high lead level and is actually physically in danger of having long-lasting physical health effects. The important thing to know about lead, though, is that it has no natural purpose in the body, and there is no safe level. So our goal really is to try as much as possible to eliminate exposure and eliminate the lead in the body. When children have exposures, even at very low lead levels, studies have shown that on a population basis, those children can have an increased risk of various kinds of nervous system problems, including grade level decreases or reading level decreases compared with unexposed children, and potentially an increase in different kinds of behavioral issues as well. So our goal is to try to eliminate the possibility of lead exposure. We can't make the lead go away in the environment, but we can, as much as possible, minimize or eliminate the opportunities for exposure. And I really want to stress, for parents who have lead-exposed children, this does not mean that your child is going to have a lower IQ. That's not what we're saying. This is on a population basis. We know that lead can have that impact. So, I want parents to be reassured, having exposure to lead, it's important to identify it so that you make sure that there's no ongoing exposure. But if your child does have exposure to lead, it is not in any way saying that your child is condemned or destined to have a lower IQ. Many children who've been exposed to lead have gone on to have normal lives, but we really want to make sure that they don't have ongoing exposure.
It sounds like lead is probably in everything at some level. Is that true to say?
Well, so the history of lead exposure, remember the Romans used lead, and one of the theories about what happened to the Roman Empire is that in fact lead mixed with the alcohol in drinking casks was one of the reasons for the decline of the Roman Empire. Lead was very widely used in this country and in other countries as a gasoline additive up through 1950. And one of the common exposures to lead was lead in air because of the burning of gasoline with lead in it. That stopped in the 1950s, but lead continued to be used and is still used today in a variety of purposes. It's a very useful metal from the point of view of industry, batteries and so forth.
Right.
What we're doing as much as possible to get it out of the paint in the existing housing stock.
Right.
But there's still a lot of lead that's out there.
And anything else in the home? So you were talking about making sure you have a healthy diet. And we briefly talked about spices, but that was something that was really surprising to me, was to learn that spices that you use every day, but making sure that they are the ones that are regulated. And we were talking about turmeric being one of those spices that is like a big fad now.
We've also had cumin, we've had the hot sauces that have come.
Chili powder,
yes,
because it has a lot of turmeric in it and cumin in it. So, one of the things we're trying to do is, at a state level, we've worked with food manufacturers. The domestic food manufacturing is very tightly regulated. We've seen this in a number of cases where people have either brought spices in with them from overseas, or in some cases they've been identified in stores that specialize in spices from overseas. And I want the message people to understand: the food supply is tightly regulated. We are responsible for food protection here in Maryland, and we take it very seriously, as does the Food and Drug Administration. But we sometimes don't have controls overseas that we have here in domestic production.
Well, especially if somebody was ordering something, I'm assuming you could probably get something on Amazon from overseas, and that's that wouldn't necessarily be regulated, right?
Well, again, you know, we stress that if for food manufacturing that's licensed here in Maryland and other states in the country, there's a lot of control over what happens, but that doesn't necessarily exist when you get into some overseas manufacturing.
Right. Did you want to add anything to that? You don't
Well,
have to.
and unfortunately, what happens with spices that are identified, it takes a lead-poisoned child, and we backtrack to see what may have been the risks. We've not found anything, and then you start talking about, oh, what kind of pottery do you use? Do you use any ethnic spices? And then you test those spices, and oh, my mom sent those over from India. We just went to Russia. We went somewhere else, and we brought those back with us and had no idea that they were a problem.
Right, that's scary. Could be just because you don't think about those things as being a health concern. Let's jump to asthma a little bit and talk about that. So we talked about mice and dust and cockroaches, which I had no idea was a asthma-producing
It's actually one of
agent.
the most important and significant allergies and sensitivities that children have.
Interesting. Why? Because they're so dirty?
Well, cockroach antigen, for some reason, you know, it turns out that for a variety of reasons, and I can't tell you, it may be because cockroaches are such an ancient species that it's a very common allergy, but it's a very common allergy.
Interesting. I'm learning so much from you today. You should be on our show every time because you're just a wealth of knowledge. What about how can somebody help reduce asthma agents in the home?
Okay, really, really good question. And as opposed to lead, where it's just a single thing, it may have different sources, but you know, kids have a variety of allergies and sensitivities, and so there are a number of things to do. First is talk with your doctor or your nurse practitioner about what are the things that specifically trigger your child's asthma. Nobody knows better than a parent or guardian what it is that it's the trigger. So oftentimes the first clues for that come from the family itself. But in some cases you can do testing. So there are various kinds of tests that you can do to look for allergic sensitivity. Those can be skin tests, they can be blood tests. And in other cases, you know, it'll be the pattern that the child has. Children with exercise-induced asthma have a very typical pattern. They're fine most of the time, but then they go out and exercise, or changes in temperature, so forth.
That's me.
Or they have, right, exactly. Or they have seasonal allergies. Another, again, a big factor is they'll be fine through the spring, and then the summer hits, and all of a sudden they're wheezing to beat the band. There are often several different kinds of triggers. Some of them are very specific. They're specific mouse allergies, cat allergies, dog allergies. And then, you know, those are things that a parent will be very wise to.
Right.
In other cases, though, for example, when you're allergic to household dust, that household dust is actually made up a whole bunch of different things, including dust mite allergen, cockroach allergen, pet allergen, and it's all sort of mixed up in the dust. So sometimes that's a little, you know, then what are you trying to do? You're trying to control the dust. So it's not necessarily the individual allergens that you want to control, it's the dust, because that's that mixture that's the problem. So one of the things that in our new program with Medicaid that we do is we send local health department staff out into the homes of children with moderate to severe asthma, and we provide both cleaning supplies and instructions and conversation to the family. So there are a lot of things that we look for. We look for, is the family okay in understanding the medication and how the medication is supposed to be used? And we can talk a bit about that. When you're looking at the home environment, are there pets in the home? Are there a lot of fabric-covered surfaces like rugs in the home? Because it's harder to clean those rugs. They often harbor dust or dust mites or other kinds of allergens. Is there smoking in the home, obviously, because that's one of the things that we offer is services like the Tobacco Quit line, which is 1-800-QUIT-NOW.
Yes.
As I'm sure
Thank
I'm
you.
sure your listeners know.
Yes.
And in addition, We can provide cleaning supplies, which include things like microfiber cloths, buckets with cleaning supplies, and even what are called HEPA vacuum cleaners, which is high efficiency particulate vacuum cleaners. Your ordinary vacuum cleaners, oftentimes, when they suck in what's ever there, the air has to go out. And unless they're a HEPA vacuum cleaner, which has a very, very advanced filter in it, you can often end up actually putting the dust back into the air, where it's actually more of a problem than when it's on the ground.
Right.
So we can provide to families who are eligible for or enrolled in Medicaid in Harford County, if they have children with moderate to severe asthma, we can actually provide them with a vacuum cleaner with this HEPA filter in it, as well as other supplies.
Yes, and so Judy's, your coworker, is spearheading that initiative.
Yes.
Yes, so that is available in Harford County. So it sounds like no antiques, no fabric, dust often. Judy and I were just talking about this in the kitchen. It's like, it's so hard to keep up with the cleaning in your house, and in places that aren't obvious to clean, and how much dust and allergen that does produce.
Right. So I on the one hand, I struggle with cleanliness myself. Nobody should actually go into my office and use me as a role model. But that being said, there are things that are a problem. So for example, the food area
Yes.
is always challenging for people, because that food is what attracts cockroaches.
Right.
So cleaning there especially and making sure that those areas are clean. The bedroom where the child sleeps, again, a really important area.
Right.
And we can talk with parents about things like, is there carpeting in the bedroom?
Right.
Are the pets in the bedroom, or are they kept out of the bedroom? Things like that. So we don't necessarily aim to change people's lives completely. That can be a heavy lift.
Yeah.
But attention to these little details can make a big difference to the child.
Right.
And one thing that is very easy to do is to make sure the child washes his hands before eating, after being on the floor, because they put their hands right in their mouth,
Right.
and the allergens or the triggers go right into their
Right.
system.
And that's also true for the lead dust. So as it turns out, these same techniques work for lead because it is associated with dust most often.
Right.
So exactly the same kinds of cleaning techniques that work with asthma work
Right.
with lead to reduce lead exposure.
That's excellent information. We are actually out of time for today, but we have a resource page at the end that will give the resources for your websites, and hopefully people can go there and get more information, call you if they need to. So that is all the time we have for today. I would like to thank my guests on today's show, Judy Turn and Dr. Clifford Mitchell. If you would like more information on lead and asthma, please refer to the resources page after this program, and join us next time for another important health issue that matters the most to the citizens of Harford County. Thanks for watching.
You've been watching Public Health Matters, brought to you as a public service by Harford Cable Network, your county connection.